Dronedarone, Class 3 antiarrhythmic agent, used to reduce the risk of hospitalization for atrial fibrillation in patients in sinus rhythm with a history of paroxysmal or persistent atrial fibrillation. Off-label use for the treatment of atrial fibrillation in patients with hypertrophic cardiomyopathy. U.S. Boxed warning, contraindicated in patients with symptomatic heart failure with recent decompensation requiring hospitalization or New York Heart Association Class 4 heart failure. Dronedarone doubles the risk of death in these patients. Dronedarone is contraindicated in patients in atrial fibrillation who will not or cannot be cardioverted into normal sinus rhythm. In patients with permanent atrial fibrillation, dronedarone doubles the risk of death, stroke, and hospitalization for heart failure. Mechanism of action: a non-iodinated antiarrhythmic agent structurally related to amiodarone, exhibiting properties of all four antiarrhythmic classes. Dronedarone inhibits sodium and potassium channels, resulting in prolongation of the action potential and refractory period in myocardial tissue without reverse use-dependent effects, and decreases AV conduction and sinus node function through inhibition of calcium channels and the beta-1 receptor blocking activity. Similar to amiodarone, dronedarone also inhibits alpha-1 receptor mediated increases in blood pressure, volume of distribution 1,400 liter, and 98% protein binding, metabolism, mainly hepatic via cytochrome B3A4 to active N dibiodal metabolite. Bioavailability with food 4%, with high fat meal 15%. Half-life elimination 13 to 19 hours. Time to peak 3 to 6 hours. Excretion feces 84%, mainly as metabolites, and urine 6%, mainly as metabolites. FDA approval date is 1st of July 2009.